Good morning, good afternoon, good evening to all from the different parts of the world. Today, 25th February, Saturday. Today is the 908th day of Zoom meeting of international session of our IFPH, International Forum for Promoting Homeopathy. So I welcome all of you to this platform. We are approaching to the 1000th day. It is now countdown. So today our guest, Dr. K. Srinivasan, MD, Homeopathy. A few days back, he had delivered a wonderful lecture in our session and made it an eye-opener for everybody, because he is very deep in his knowledge and repetition. He told us everything, but this is the second session he's taking. He's an intelligent person. So let us have a silent prayer before starting this session. Let us have a silent prayer for 1 minute to get revelations and knowledge and wisdom from God to bless him and for us to deliver his speech and his sharing. Let us have 1 minute silence. Thank you all. Dr. K. Srinivasan, MD, Homeopathy, visiting professor, Shivaraj Homeopathic Medical College, Salem. MD in Sonajirao Shirsagar Homeopathic Medical College, Beed, Maharashtra. Speaker, various conferences in Canada and India, practicing at Chennai and Salem. Visiting professor of Shivaraj Homeopathic Medical College, Salem, is having 22 years of experience. Today, a special subject. We know that we are treating homeopathy with men and even in veterinary and using now in agriculture. Many sessions are now, we have the fields. So many fields are now we are approaching and we are getting fine results from that. Today, our subject, doctor dealing with what if my patient is a cow? You know that animals cannot speak. They cannot say what is his problems. But observing an animal, cow, and finding what is happening, what is his, we know that human beings have an anatomy, physiology, and everything. But animals are different. Each and every animal is a different body structure and constitution. So we have to understand more than while studying the veterinary colleges, they have to study each and every animal have its own physiology, its own anatomy and everything. But we are only dealing with human anatomy. But after studying this, if handling the veterinary medicine is another sphere, a very vast field. So I welcome Dr. K. Srinivasan, MD, for this platform, for to share his valuable knowledge, and we hope that he can do well. Thank you, Doctor. Now, for the 45 minutes will be your lecture, and after that, we will ask so many questions to you. Thank you, Doctor. You're welcome. Most welcome.
Screen share.
Okay. Dr. Baburaj, please share his screen. Dr. Baburaj? Yeah.
Thank you very much, sir. About the title of my talk, dealing with human beings, understanding the problem, coming to a totality, giving a remedy itself poses special challenges. Sometimes it's easy, sometimes it's a big task. At this point, two family friends of 3 generations who are also taking homeopathic treatment from me, they approached me that I should treat their pet animals, their cattle, etc. I told them I have zero knowledge about veterinary medicine and never applied homeopathy to any single animal, bird, or I was reluctant and rather refusing. He laughingly told 2 beautiful points. Doctor, don't worry. We have already treated our animals with allopathic veterinary medicine. Results are not coming. Only such cases we are bringing to you. And you're skeptical. Suppose you are giving homeopathic medicine to the animal is not improving and becoming bad, will certainly take to allopathic veterinary medicine and put all our energy to save the animal. So the animals will not die in your hand. We are just trying to see if homeopathy can help these animals with full understanding that you have no knowledge and experience with animal homeopathic treatment. I said, okay, but brothers, one on the left extreme of the screen is Govind Bhatt, and one on the right extreme is Krishna Bhatt. And they encourage. Then gradually, by treating these animals, I came to understand one very great truth and a very great practical tip to improve treatment of human beings with homeopathy. So that is the correlation of the title, that when I can treat with certain totality in animals, why cannot I apply the same technique while treating them? So that is why the title is, What if my patient is a cow? Only 2 sample cases are animal homeopathic cases, the rest all is from human beings. So with this understanding, we'll proceed to slide 2. The first case was Krishna Bhatt telephoned me and told he has a cow in his farm which is passing undigested stool. Strangely, he observed one phenomenon. Suppose he gives green grass to the cow today, next day the stool contains undigested green grass. If he gives straw today, it passes undigested straw next day. So like this, whatever food he gives today, that is passed next day undigested. So this drew his attention. He was careful enough to observe this point and beautifully and narrate to me. So I wrote down the complaint. Only this much he told. Stool, undigested food, eaten previously. I was looking for exact reference, and while going to NER repertory, the most direct exact rubric is stool, lean sherrick, food eaten previous. The remedy was oleander. I read oleander materia medica in herring dialectic system. The symptom was exactly this. So what I told is give oleander 30, 1 dose immediately, and 1 dose after every lean sherrick stool. So this way we can adjust the dose, and if the patient or animal improves, there is no need for repetition. Instead of blindly repeating, the technique is 1 dose now and 1 dose after every attack. This can be applied with loose motion, diarrhea, vomiting, fever spikes, any such thing which has spikes or attacks. So by setting the dose, the cow becomes completely all right, and thereafter there is no lead shedding at all. Cow becomes completely was following the cow's improvement, and Krishna Bhatt was in touch with, and the cow improved dramatically. This case of slide 3, please. This is the case of their pet cat. There were a lot of kittens in their house, and two kittens were very emotionally attached to each other and very friendly. See how they observe the pet animal. This is most important. If the observer is careful enough and able to see reliable data, even the most smallest and the least information can take us to the right remedy with exact reference in our reference book. It's already been done extensively. So here what happened, one kitten went out of the house, played in the road, and was hit by a two-wheeler, smashed, and died on spot. This incident was seen by the other kitten, which was its playmate and so closely associated. And since then, there is dramatic hair fall. The kitten, it almost become bald over the entire body. I wrote down these points, which is conveyed to me by Govind Bhatt, and the exact reference is what you see in the screen. Near external head, hair fall, grief after and sorrow, or after fever. The remedy was phosphoric acid. Exact. This is what exactly what care intervention, and the exact reference is here. And after phosphoric acid, within a week, the cat was full of hair for the entire body, and the cat became completely active, the facial expression, with all activity became normal in that period of time. So there are many such examples which Krishna Bhatt and Govind Bhatt referred and discussed their animal cases with me. The information is very short, very precise, and interesting, very interesting. The information they provide is characteristics, observable, verifiable characteristics. This we can observe carefully, verify whether it is true, and it is characteristics. So when such observable, verifiable characteristic is present in human beings, the results are excellent. So this is a very big learning through my treating animals and seeing the drastic results with them, even though the information is almost one line or two lines. So slide number 4. So all these hereafter are human cases. The point I wanted to insist by the title is, by carefully observing such points, what I learned from animals, we can apply the same technique in human beings. Suppose I took a full case and there is no head or tail and there is chaos, confusion. I take a pencil, very carefully go through each point I have noted down and underline. Suppose my patient is not able to express, suppose he is a cow. What observation is available for, which is verifiable and character? That I underline, verify, see the exact reference. If I am convinced with the repertory and remedy, I prescribe. The results are excellent. So the technique is verifiable, observable, characteristic, exact reference. The results come very fast. So here, many of the participants here, they must be aware of testimony of the clinic by E.B. Nash. I was so impressed by the cases reported in testimony of the clinic by E.B. Nash. They are deadly cases, and Nash and all the authors who reported their cases in that, they have produced the result within 1 day, within 12 hours, within 6 hours also, and saved the life where technology and all other facilities are much less. So that's a wonderful book and eye opener. So here is the other case. This is a human case. Sunil Sarkar sir's case, you can see him, listen to his cases in YouTube. He is a wonderful practitioner who lives and practices in Kolkata. I visited his clinic and there were 10 ambulances waiting outside his clinic, not to carry patients from his clinic to other hospitals, but hopeless cases from other hospitals brought in ambulance waiting to see. In one of his YouTube video case, he presented a case where laryngeal carcinoma, stage 4 came to him, and patient wife told him solid food he can never swallow, liquids goes inside with a difficulty. Strangely, if he drinks liquids like juices, soup, and other things, it goes inside, but water comes out through his nose. So this is an observable, verifiable characteristic. Cannot follow solid, liquid goes in, water comes out through the nose. The remedy he told was Epilobium palustre, and the reference he told is T.F. Allen's Encyclopedia of Pure Materia Medica. So for me, it is difficult to remember Materia Medica. This case I saw the night 11 o'clock at home. So I became so curious and excited. I want to see where exactly this is in repertoire. So I ran to the clinic at middle of night, and Allen's Encyclopedia has 2 volumes of repertory. Volume 11 and 12 are repertory. There I repertorized the case. I found exactly this rubric, water coming out through the nose. Then I came to Materia Medica. Here you find under Epilobium polyster the exact symptom of a prover which the patient told. No, previous slide. I'll tell you slide change. So the exact symptom is on attempting to swallow, water would fly out of my mouth. This is exactly there under epilobium. And Sir gave epilobium, cancer is gone. And had I not seen this case, I would have missed my patient in not prescribing treatment. Slide perfect. Next slide. Yes. What I do with all my patients, I am doing this technique since 2011. I request all my patients to write down their complaint and all the chronic cases are acute. I tell them what to observe, what to write, and they write like this. And if they come in person, I'll discuss or WhatsApp, whatever. This one page written in Tamil, and here exactly the diagnosis of the child is cerebral palsy, and all on allopathic treatment and zero improvement. And the exact point what Sir told in his case, it is there in this child. Swallowing solid very difficult. Liquid goes inside, but water comes out through the nose. I suggested, because I was not having stock of epilobium, I suggested the parent to buy epilobium from Helios pharmacy from England. They are wonderful. So they ordered Helios and got it in 2 days. And Helios was given to the child. And I'm following the child for 1 year. He had started showing wonderful improvement. It is a joy to see that. So the exact reference. So that's what I tell all my friends and colleagues and students. I am just a clerk. I'm just a clerk. The greatest work is being done by provers and great masters, and the reference is always available. Just that I have to observe, take the case, find out, pick out the point, see where it is already given, give to the patient. That's all. So this is another verifiable, observable, characteristic, uh, and exact reference is there. It has produced wonderful. Slide 6. Okay. This is the case of a child. Interestingly, mother noted one point. Doctor, child vomits salt and it had fallen on my hand. It was very hot. Okay. I first searched in Kent, not there. Boninghosen, not there. Boger, not there. Their repertory, not there. Then I went to Allen's encyclopedia repertory. The exact word vomiting hot is there under codophyllum. I went to Allen's encyclopedia pure material medical codophyllum under stomach. Exact symptom vomiting hot. So I gave one dose codophyllum and told to repeat if the vomiting continues after every episode. That's all. There is no more attack of vomiting. With one dose, I'll become all right. That's what Kent says. Your right remedy, Kent and Nash, Boger, your right remedy should save the next meal. That means it should not be vomited. So that is the classical saying by Kent, Boger, Nash, everybody. If we are treating vomiting, one dose and next meal should stay. So that is code. Case number 7. This is another YouTube video case. I feel so happy to share the master's cases than telling my own case. These people have done wonderful cases and reported excellent results. So this is again a case of Nirmal Khattar where the patient's bilirubin was 21, so much jaundiced. I will not dare to take it. I will be more reluctant, afraid, dodge the patient, ask them to take parallel allopathy, admit in allopathy hospital or refer or wash off my hands, something. But this is one thing, learning from masters and learning how exactly they work. There is no question of courage or fear. If we apply principles and techniques accurately, just that results will come. That is the only thing. There is no question of courage or boldness or this. Learn technique without error, apply it without error. Just result is there. So in this case, interesting, this is also available in YouTube. The patient was deeply jaundiced. He was an alcoholic with a massive ascites, pedal edema, and panting for breath. He was being supported by some 3-4 people, 2 people on either side, and accompanied by his wife and mother. They told sir the entire history, and interestingly, they told one point. Doctor, we have noticed he finds it difficult to walk the plain floor. He feels dismayed. But if he ascends 2 flights, 3 flights of floors, ascending stairs, he is not a dyspnea. His dyspnea is only when he walks on the floor. This drew his attention. So this was observable, verifiable, characteristic. And the exact symptom is there in Kent's repertory. And you see that under respiration, dyspnea, when walking ground, not when ascending. The remedy is ranunculus bulbosus. And if you read ranunculus bulbosus in Allen's keynotes, Materia Medica by H.C. Allen, all the complications of alcoholic features are there. Allen's keynotes, every word is condensed from hearing guiding symptom Materia Medica. Every word we can find in hearing guiding. So Allen condensed so many things from his own experience, observations, and applications. And the ranunculus bulbosus is a wonderful anti-alcoholic sequel remedy. So Sar gave ranunculus bulbosus and his bilirubin level came to normal. And his ascites gone, pedal edema gone. He quit alcohol, became a useful physician and useful to the family. And so this is observable, verifiable, characteristic with exact reference. And that is something. Slide number 8. Yes. So here A child was brought to me who was suffering from chronic constipation. The parents tried all pathies, home remedies, allopathy, this and that, but less and less and less. They are desperate. The full case was taken, and one interesting point they told me, the observable, verifiable characteristic out of all positions, lying, Indian toilet, natural toilet, Western toilet, and standing, they tried. I am surprised why these people observe so many things. Maybe I would not have done such things. And they observed one point. The child was able to pass stool better out of all positions while standing. So this is one observable, verifiable characteristic. And I could find the reference in Think About It, that constipation passed better standing while the remedy was osticum, and child became completely all right. And interestingly, that has improved the general health status as well. This I observed in many cases, even though I prescribe on single observable, verifiable character, as this remedy covers the general mechanism which is altered, the general altered pathophysiology, all the other complaints which are reported also goes on. So that is what I noticed, and I am more critical while treating even fever cases, cough cases, diarrhea cases, vomiting. Even though they come for a single complaint, that is a potential chance and opportunity for homeopathy to touch them through a possible constitutional remedy. So even the first homeopathic prescription for fever alone could be a constitutional remedy which can produce a revolutionary positive change in the individual. So I spend more time even with fever. Not that I give any routine fever remedy or favorite remedy. I don't do that. Because I know even the first prescription as a single dose of a fever case can be a constitutional revolutionary remedy which can remove fever, prevent lot of other diseases in the child or individual, as well as remove chronic diseases which the patient is suffering. So the homeopathy should be aware of this point and more critical and careful in each single prescription. Slide 9. Okay. So this is another, an athlete came to me with a chronic complaint of difficulty breathing and so many other things. And in this case, the point that drew my attention was, he says, when I am running, I have dyspnea, but it doesn't become worse. But when I move around slowly, sit, walk, or slowly jog, slowly run, my dyspnea is. This drew my attention. This is observable, verifiable, and character with exact reference in things about the respiration, difficult, not while running, but after slow motion. The remedy was sepia, and that removed this complaint, symptom complaint, as well as improved on overall. Okay? So the exact references. Next slide. Interestingly, I have seen many patients. We can take the case of the person who is coughing now. It will be very interesting if you can tell your complaint. The cough looks like a female cough. Am I right? Is the patient is a female doctor? Yes or no? Okay. Sorry, I don't intend embarrassing you. I thought it will be a live learning. Okay. So initially, When patients started telling they suffered from typhoid and jaundice together, malaria and jaundice together, typhoid, malaria together, many mixed infections, I was perplexed whether these people are telling truth, because in organ we read what happens when three dissimilar diseases meet together. First possibility is one of the possible, I don't remember the exact order. If the new one is stronger, it suppresses the old, runs its course, it disappears, and the old one comes again. Second thing is, this applies to acute as well as chronic. That is what I understood by those aphorisms in organ. If the new one is weak and the old is stronger, the new one is never allowed to enter the organism. It stays the way. The old one prevails. And third is, they occupy their own places and runs its course. Probably then I thought the third possibility is working here. Two or more acute diseases can coexist. See, actually more learning comes from application and patient than our own teachers and the students or colleagues. I found that patients are greatest teachers. They show us so many things for which the literature reference is available. They have opened my eyes several times where I found I had prejudice, and when patient says, and I go to the reference book, it's exactly there on giving the remedy, it works, and my prejudice is broken. This happens every day and happens several times. I'm not ashamed of it. So this patient was presenting with the clinical symptoms, fever, chills, cough, digestive disturbances, tongue coating, malaise, and several other complaints, and test reports of typhoid malaria. Hmm. And he came with fever and chills. Interestingly, the temperature recording showed subnormal temperature. His temperature was 94 degrees. How is it possible? I was perplexed and I don't know what to do. Then I thought, okay, anyway, it is there. Let me see the reference. And I took NER repertory under fever chapter. Under fever chapter, we find temperature decrease subnormal below in typhomalarial fever 20th. The remedy was chamomile. Otherwise, I would not have thought of this remedy. Maybe I would have worked out with something else. So observable, verifiable characteristics. Subnormal temperature in the case of fever, very high temperature. Body was high, hot to touch. He tried allopathic medicines on his own from pharmacy, from allopathic clinic. Nothing worked. And on giving hammer, he recovered so quickly, completely. So this was an eye opener. So the reference is always there. I don't have to do something new or concoct any theory. So this is one very great learn. So the reference is from NER repertory. I studied Hamamelis in hearing guiding symptom, and this symptom is exactly there. So I verified under Materia Medica to understand whether the rubric and Materia Medica meaning, context meaning is same. Sometimes the context meaning is same. So be skeptical and careful. If the context meaning is not matching with Materia Medica, I don't use the remedy. Okay. Slide 11. Next slide. Yes. Now, this is a patient with another grave pathology. Initial years, the pathology was troubling. because of background allopathic training, because I underwent intense allopathic training only to know what medicine is, what medical practice is, to just understand it, not to practice allopathy as such. And then I came to homeopathic practice. So initially I was very much afraid of grave pathological cases directly coming to me and seeking help. Many cases I faltered, patient dropped out, we went to see other homeopaths, many things had happened. Gradually, with the help of my friend who shown their cases where they are not blind to pathology, but they are not affected by pathological diagnosis and not influenced by that in selecting a remedy or taking a case. Ah, So gradually I developed confidence. This is one case where, so and thereafter I don't present, I don't present the diagnostic names of cases or I don't show pathological reports because I'm convinced that there is truth in homeopathy and its application. So it is the onlooker whether to take it up seriously and study homeopathy and apply. So I don't want to convince anybody. Just that I say this is possible and so I don't bother about pathology or showing the report or showing video cases. Or anything. So this patient, the clinical symptom was the lower limbs were so much swollen, patient had difficulty breathing and auscultatory finding the chest. The entire case was taken the usual chronic case format and the observable, verifiable characteristic was lower limb swelling, edema with rails in chest. This I can demonstrate to any student or colleague. I mean, such cases. No? Anybody can do that. And the remedy given in their repertory was shine. Lower limb, swelling, edema with rails in. With the chine, patient gradually improved, lung signs gone, edema disappeared from above down. All the other vital parameters become stable and patient becomes completely asymptomatic. Okay, so that's another case. Next slide. Okay. In the initial years, when I was reading Davidson or Harrison medicine, the book gives one diagnosis and most common clinical prescription, not everything possible under the sky. This point, patients taught, and the learning was like this. When patient comes and say, Doctor, I'm taking antihypertensive, I ask them, what complaint made you go to the doctor? They say, I had heel pain. I went to the doctor. They checked my BP. They found the BP was high. They put me on antihypertensive. What happened to your heel pain? After taking antihypertensive, my heel pain reduced. That means in this patient, the heel pain was due to high blood pressure and not due to any local problem in the calcaneal bone or area. So like this, not only polyuria, polydipsia, polyphagia, all these things diabetes, even hair fall could be due to diabetes. Ear infection could be due to diabetes. Skin itching in a small localized area could be due to diabetes. So these things I learned. Of course, there must be reference in the book also, but these things I learned in a breech presentation from patient to book. So this patient was having chronic heel pain. Initially, she went to many ortho doctors. They put on analgesic, topical application, even they injected injections into the heel. All these helped temporarily. Then she accidentally happened to go to a general physician, MD general, and he routinely checked her blood pressure when she was found to be hypertensive. he was put on antihypertensive, and then also the heel pain was fluctuating. It gave 80% relief. There is little pain remaining. Then patient was sitting in another chair, and then after a while began to walk with the tiptoe, walking on the toes, came and sat with me. This attracted my attention. I asked, "What are you doing?" Then she told me, "When I begin to walk, I get a severe pain in my knee. But if I walk like this, or even walk with normal foot for some yards, then the pain disappears." Okay. So this I took observable, verifiable, characteristic of them, and the exact reference is in record. Extremity, pain, lower limb, foot, heel, walk on beginning to remedy. So I put the patient on pulsatilla and the pain disappeared. Able to withdraw the patient from antihypertensive, and her BP was also continuously monitored. She became completely normotensive, and the diet was also made normal. No restrictions, normal lifestyle. Okay. So I am not discussing, all of you must have noticed, I am not discussing about potency or dosage, only the depth. The potency and dosage is a totally different area, which itself requires larger discussions and lectures. Okay. So here I am insisting upon what was the single point I want to present. The point is observable, verifiable, characteristic. Look for exact reference, prescribe a reference. And next, last thing. This is one more case of a cow, which Bhatt brothers referred to. Suddenly, one of their cows, after delivery and feeding the calf, was not taking food properly. They first called a veterinary doctor. He examined the mouth also and found there is thrush, oral candidiasis. They tried veterinary allopathic medicine, which did not help. Then they called me and told this is the problem, whether I can help. I said okay, and then the exact reference is snare repertory. Under pregnancy, parturition, lactation, you find under lactation, subrubric mouth of mother, thrush. The remedy is calimuriaticum. On giving calimuriaticum, the cow became all right next day and started taking normal. Okay. So all these I am presenting, all cases are single remedy rubric. Single remedy rubric works provided it covers two or other features also in that. That is what usually happens. Here I presented how I came to the remedy. So I verify whether there is any more matching features are there. Usually when such one or two more points are there in the case, there the remedy works radically. If it is only one symptom, the result percentage is usually 50 to 60%. There is otherwise 40 to 50% fail. You have to look for other to diagnose always. Okay. So I think that is a summary of my presentation today. If there is questions and discussion and sharing of experience from other members, please welcome.
Please close the sharing. Doctor, it was a very wonderful and very beautiful presentation from you. As like before time, you did very marvelous demonstration. Now also you did a marvelous demonstration of single medicine practice. So I think that you did not mention the potencies you told or already told, but what potency you used most of the cases?
Acutes, 200s and 1Ms I used, and 30 also, sir. 200 and 1M works much faster and quicker, and it goes deeply also, and I don't see aggravations. If it's a chronic case like chronic constipation, this and that, usually I go with LM potent. Usually, I start with LM1. Usually,
Thank you,
and
doctor.
advantage with LM is we can repeat as it is an aqua 2 times, 3 times, 4 times, and I can repeat C potencies also. Put one pill in liter of water, give frequently depending on seriousness of the case.
Thank you, doctor. Then anybody please raise your hands if you want to ask any questions or add anything to more to his. Please raise your hands, then I shall allow. So there is one message. Sir, thanks for the excellent presentation. Would like to ask, how do you search the hot mucus in Allen Encyclopedia when plenty of remedies there?
The point was, I went to Allen's Encyclopedia Repertory, volume 12, and under vomiting, hot, the remedy given is podophyllum. That is vomiting, hot, podophyllum. So I came back to Materia medica podophyllum to see whether vomiting hot alone is given or anything more is given. And then on coming to Materia medica, there I found hot frothy mucus is vomit. Because of that confirmation, I prescribed podophyllum.
Another question from Manjula, Dr. Manjula, epilobium, which potency given to that patient?
1M.
How often you give the 1M potencies?
I put one pill in 1 liter water, ask them to drink, finish it off in both chronic and acute cases. Or if I'm putting it in 100 ml aqua, I ask them to succus and take 1 liter. I can share the bottle I use maybe next presentation. 100 ml aqua, amber bottle, glass bottle, and put one pill medicine, indicated medicine in that. Fill it with 100 ml Kinley or Bisleri or Aquafina water and add rectified spirit. Ask the patient to succus it and take. So C-scale potency, one technical disadvantage is the potencies are a huge jump, say from 30 to 100, the gap is 170 potencies. From 200 to 1M, there is 800 potencies in between. From 1M to 10M, there is 9,999 potencies in between. So this is one technical disadvantage with C-scale potency, liquid dose repetition. In centesimal, it is LM1, LM2, LM3. So the raise is very, very smooth. So that is advantage with LM. And if I give centesimal potencies in water, it acts faster. Dry dose also works. In my observation and type of practice, I found C-scale potencies work faster if given in water.
Now, anybody want to ask questions or want to share your knowledge? You
Sir,
can add.
Please check with the doctors who ask question whether I answered their question and they are satisfied. If they want more clarity, I can answer them a little bit. Thank you. Yeah.
Now, Dr. Hariharan sir, please unmute and ask or share your.
Okay, good evening, doctor.
Good evening, sir.
Sir, your class is nice, and you are finding out the medicine by the rubric is also very correct. Appreciating you. and the administration of medicines is different. See, administration is important also. Usually, I am administering the 50 millismol potencies in 1 liter of water, only 4 pills. 4 pills means number 10 pills, only 4 pills in 1 liter of water I am giving, and I am getting very fine result. In constitution also I am giving like this. See, calcarea carb, calicarb, pulsatilla, whatever may be the medicine, I am doing like this. I am getting very good result. So, in our repertory, a lot of single medicine rubric is a lot of, we can see that in Ken repertory, and see this Pathak repertory, or see Morning Arsons, or Kinnair, single medicine rubric that is acting well and fine. So only thing is, the merit is that how the case taking, how you are taking the case. That is what is very important. The patient narrates all the story, but in their own language, and we have to find out the exact rubric. Then only the result, we will get the result. See the PQR symptom. If we find that only, if it is only a one symptom, if we are go through that symptom and getting the single one remedy, it will act wonderfully. All other symptoms will disappear.
So someone has raised a hand, sir.
Yeah.
Okay.
Now, Dr. Sunil, please.
Yes, sir. Yes, sir. Good evening. Hello.
Yes, sir. Please ask.
Yes, sir. Sir, your presentation was very excellent. I would like to ask one thing about management of fevers. You said that giving constitutional medicine, single dose will be sufficient. So I would like to ask, in case of viral fever, what is your observation after giving a single dose of medicine, whether the fever runs its full course, or after giving the single medicine, whether the fever comes down?
It comes down immediately.
It comes down immediately.
Immediately.
Okay.
If our remedy potency dose is accurate, I've seen within 5 minutes fever is gone. Within 5 minutes.
Okay. Thank you, sir.
And one thing I want to emphasize here, sir. There are many instances where after taking the full case, I have not understood what is the problem. Many times. So I don't prescribe immediately. I say, let me, not only acute cases, chronic cases also. So I tell them, you please wait, or you do whatever you're doing now. I take their phone number, refer. If I understood, find the right reference, and I'm convinced of the remedy, I call them back and say, take it. So,
sir, so you're saying that in case of a fever, we need not consider the acute presentation like thirst, restlessness, like that, chilliness, headache, something. Any symptoms?
Yes, all that we should cover all those points.
No, actually, I want to make it clear whether suppose a patient comes to you for a chronic case and you have diagnosed a particular medicine as his constitutional medicine, whether that medicine itself will do in acute cases, or we have to search for the acute totality.
Will come from this side. The point I told is, patient come to us with fever, we take fever totality, we prescribe an acute remedy. the acute remedy can also act as a constitutional remedy. I think that is what I told. Correct.
Okay, sir. Okay.
Dr. Hariharan sir, please.
Okay, sir. Thank you.
Sir,
Yeah.
why we are treating a chronic case? Suppose a diabetic case we are treating, and we find out that diabetes is lycopodium is the remedy, and we are proceeding with the lycopodium and see the patient is getting very good relief. At the time of the course of treatment, some exacerbations of some symptoms see in that patient, what will you do?
If the acute exacerbation is very clear, very strong, indicating another remedy, I will give the another remedy.
Pardon?
Point is, the acute exacerbation, the symptom complex should be very intense and clear cut. Pointing to another remedy, I will give that another remedy.
Okay. Then
If it is
after
indicated.
After the exacerbation is subsided, you will again go to the constitutional remedy. Is it so?
If it is still indicated.
If it is still, again you will take the case.
Yes, sir.
Okay. See, another doubt is that, sir, in your experience, in my experience, that while we are treating with the 50 CLM potency for a chronic disease, sometimes it may show some stagnation. Then what we can do at that time?
Title of the next class.
What is that?
Title of the next class.
Pardon, I am not.
This is, yes, sir. Usually it is indicated nosode, I think. Indicated nosode, no theory. There is another method to calculate what is indicated nosode, and I give that indicated nosode.
Okay. Then you will give indicated nosode. Okay. Good.
Someone raised the hand, sir. Please.
Okay.
And see the time also. Maybe you have to go to Malayalam session. I am free, but I think we can answer the last question.
Sir, another question I like to ask you. Have the time, Dr. Gilbert? If it is time, I want to know one doubt.
Yeah.
See, what is vital principle and vital force? What is the difference between vital principle and vital force? It is apart from your subject. It is one of questions. Can you answer for that?
Vital principle is wife. Vital force is second wife.
Vital principle is
Wife.
And vital force is
Second wife.
okay. See, my concept is that in the vital in the explanation regarding vital principle and vital force is that external manifestation of vital principle is the vital force. Is it so? No.
No, I don't know.
Okay. Now we can leave the subject.
So there
Okay.
is someone who raised their hands to ask them question. Just check.
Nobody.
Sir, you can share my slideshow with all participants and my WhatsApp number also.
If Hariharan sir, please say a word of thanks.
Okay. Very good, Dr. Srinivasan. Very nice presentation. Very nice presentation. I am appreciating you. See, again, you come with another subject.
Okay.
See,
Thank you very much.
another subject. Okay. Thank you very much.
Thank you, Dr. Srinivasan sir and Dr. Hariharan sir. Now we are going to our Malayalam session. Before that, I asked Dr. Danesh to say something.
Yes, it's really a very good
Please, Mohan.
presentation, and congrats to Dr. Srinivasan and Dr. Hibbert for very good moderation. Thank you all. And tomorrow we will have a session from Dr. Paul Joseph from Canada. He will be presenting. The subject will be a different one this time. Everybody can join by 8 p.m. tomorrow for his session. Thank you.